we had a very premature son, Gabriel, in May 28th of 2020. He was supposed to be born in October. And so during that transition into that new role, and as a vice president, we had a newborn that spent 6 months in the hospital that we were going to see. And so I was going into the office worried, afraid that, I would contract COVID in some way and pass it on to him. And we were fortunate and lucky that never happened. A lot of things he did pick up, in a ICU setting, but not COVID, luckily. And, we survived that and he's doing awesome. But, I talked to you about connecting with people. Part of what I learned and started to do as a director before I went into my first vice president's role was really important to me that I connected with all new team members at day 60 of them starting with the organization. That the managers also did. So we onboarded them, we trained them. That day 60 check-in for me was to say, how are you feeling about the organization? Are we what we said we were? Are we giving you the tools that you need to do your job? Hey, I'm looking at your metrics. Here's how you're doing compared to your peers. In some ways, people had opportunities to improve. In some ways, 60 days in, I had people that were performing higher than the people that had been in the job for 6 months or 6 years. And I thought it was important to give them the feedback that I received from their leaders that I observed personally so that they knew how they were doing. And they knew that we were all looking and rooting for them. The other parts of that is if they had things that weren't going well, it would give me an opportunity to go to that leader and say, hey, this person doesn't have the equipment that they need to do their job. They're performing well, but just imagine if we got them a dual monitor is one example I came across. I had a follow-up rep that was working off of a single monitor, was actually performing better than all of her peers. When I brought her in at day 60 and say, hey, what can we do for them? She said, I don't have a headset. I don't have a dual monitor. And I said, but I'm looking at your report and you're like doing better than everybody. And I went to that manager and said, just imagine if she had the tools she needed, how successful she would be. And so the other thing I really enjoy doing is staff meetings, not always attending staff meeting with my leaders, but periodically popping in, giving, my perception, my expertise, my philosophies on leadership, share the 3 C's with the team. And so at the time that COVID happened, I went into a new job and I had this grand idea that I would get an opportunity to meet with all of my reports at different points in, my first 6 months there, share with them the vision, share with them where we needed to go, where I thought we were going, what we were doing well, what we needed to improve upon. Also those individual meetings with leaders. And so because of COVID and people were, all of a sudden working from home, I wasn't able to do that. I wasn't able to do that for about 9 months prior, from March to the end of 2020, our first team meeting where we all got together. And when we did meet together, we had to, be so far apart. We had limited space, instead of having 200 people in the room, we had to break it up and do them 20 or 30 at a time. So there were times when I would do meetings back to back because we couldn't all get in the same room together. But what I did though, is I still was able to do the things that I wanted to do in a lot of ways, but we had to just do it differently. And so when you think about that and the earlier point I made about driving people, using people that are there to do a job to improve your performance, I wasn't able to impact the people in the performance the way that I normally am able to because of COVID. And again, we were up against a lot of things because we were trying to drive performance when we really didn't have patients that wanted to come to the hospital. Patients were not being diagnosed when they needed to be. And when they were diagnosed, they weren't necessarily having follow-up treatment that they needed because they were afraid, of whatever their issue was. It paled in comparison to what they might pick up at the doctor's office or in the emergency room or in one of your, outpatient departments. It's really difficult process to go through. We were able to drive some improvements even through that, but it did take a lot of brain power, a lot of collaboration, a lot of thinking about how we go about the work in different ways. And, we had people that were willing to work from home, but we also had people that were not willing to work from home. And so we did a lot of work trying to accommodate the desires of the team member while still trying to drive performance for the organization. And so when I look back on that period of time, I'm really pleased and ecstatic that we were able to make some really good financial improvement at that organization and also grow some people and promote some people in that process and bring in some new leaders to help. And so really successful point in my career. And so, we did that despite really the challenges a lot of organizations were having during that period of time.